To get started on the lower part of the face, we really need to start with the mouth muscle, or what's known as the Obicularis Oris. That really anchors everything that we're going to need to do around here. The Obicularis Oris is really just going to be the round muscle coming in with an opening for our mouth. Now, what's important to know about the Obicularis Oris is that it's not what they call a true sphincter muscle. And by sphincter, I just mean completely round muscle, the fibers going all the way around, the job of which is to just contract. The Obicularis Oris is actually 4 muscles that are connected to each other. So there's 1, 2, 3, and 4. They're fibers pulling this way. This allows a lot of flexibility. This allows one portion of the mouth to flex and pull one direction or another direction. Or I shouldn't be dragging them this way, but to tighten or to relax so that it spreads out, things of that nature. This independent quality is really important for our expressiveness, but everything done and said, we just need to keep in mind that we're talking about a kind of spherical surface here with an opening in the center and nodules at both sides. Nodules on both sides being really important. Now, over time, we're going to be talking about the inside versus the outside portion. The lips themselves are part of the inside portion. So lips, the red lips, are part of basically the interior of the muscle as it is coming out. And that is in contrast to the outside or the exterior part of the muscle, which has a slightly different form. So this is an important thing for us to keep in mind. And let's get in and start to create just the primary basis first. To do this, I'm just going to use a very simple surface, probably even just a simple sphere that we pull in and start to sculpt. I'm just going to append the sphere. Transparency is on. Scale is active, symmetry is on. Move it down. Remember our rule from the beginning. The corner of the mouth could be seen as coming from the middle of the eye. So that'll help you get a sense of where to put the nodule. The corner of the mouth, of course, is going to be inside of the nodule, so that would mean that the nodule would be outside of that point. Again, the corner of the mouth doesn't have to be right where the middle of the eye is. That's not necessarily the case. But I'd say everything done and said, we're in good range here. We can use transpose to also get this positioned horizontally, or you can just do that yourself with the move brush, but I'm going to position it underneath the nasal, the nose right here, and right above the chin lip fold that we actually have an anchor for. Now, from a side view, check your tissue depth and your rotation, but a real simple tug with the move brush is going to pull all that into place. The one thing that's not pulled into place is the side. So let's get that done. And consider using Move Elastic. And let's evaluate first where the corner of this mouth needs to go, or what's the circumference, really, of the masseter. From a side view, we can draw a couple of lines just to make our life easier. Pull down from the nasal opening and pull down from the zygomatic. Where is that nodule at the side of the mouth? Where is that going to be positioned? Is it going to be positioned in front of the nasal opening? Unlikely. It's more likely to be positioned in the back of that nasal opening. But how far back can this go? There's, of course, a lot of variety, and everything's going to depend on the specific curvature of the mouth and just how large the muscle is. But in our case, I think we're going to be safe putting it right around or inside of where that's going to drop down from the nose. So careful with move elastic. Got to lower that draw size. Symmetry is going to be off. And I'm going just inside. Okay, and now do you remember where the line of the lip is? Remember, we have the line of our teeth. This is very clearly indicated. The line of the lip is not where the line of the teeth are. Remember, it is actually in the middle of the upper teeth. So it looks like our mouth is going to move back like this. This is going to be our upper lip here. Our lower lip, on the other hand, is going to span most of this to about this angle. Get our nose in there, nostril, orbit of the eye, all of that, the cheek, masseter. And we're working pretty well here. But keep the line of your lip high. So I'm going to use standard brush, and I want to put the line of that lip in there. It's a really important point to indicate. And then come straight down for the corner of the side, the corner of the mouth, basically. Okay, so there's a lot to know about the mouth, but it's fairly simple to sculpt. As I mentioned before, you've got inside and outside. So the inside is going to be the lip portion, and that's going to follow certain clear rules that go all the way back and past Michelangelo. So if you grab Edward Lanteri's book on sculpting, remember he's Rodin's teacher, you'll be able to see 3 parts to the upper lip. 1, 2, 3. The lower lip has 2. 1 and 2. So we want to keep these in mind. These are part of the inner portion of the lip. And they're going to have a very specific quality. I want to make sure, number one, that the upper lip is dominant over the lower lip. And there's something I've learned from a plastic surgeon friend that really helps that. And that's to put in the marionette line. So I'm going to put a marionette line in here. You know, the marionettes, where the whole lower part of the mouth is able to just kind of pull down. This is an important line as we get older, but you still see it in the youngest of person. It really helps us establish the dominance of the upper lip over the lower lip. Watch what I mean. I'm going to come in with the clay brush. I'm going to pull right down from that corner of the mouth, straight down. Now, no matter what, the upper lip is always going to ride over that, whereas the lower lip is now inserting in. And that's what we want, because the lower lip, the muscle fibers themselves actually insert inside in the inner corner, just inside on the lip. Let's augment this, though. Let's make sure that we've got the 3 portions of the upper lip that we described. Smooth this out. And the 3 portions here. Notice that the sculpting is not that good. And this is really important to note, because what I'm doing right now is more conceptual. I know that there's 3 parts of the upper lip, so I'm just running my brush along 3 parts of the upper lip. But I have missed a really important stage. And if your lips do not look right, the chances are you have missed this stage as well. You need to establish the plane. You need to establish how this part is turning in. The down plane. And then we need to establish the up plane of the lower lip. have to have those intact, or none of this makes any sense. So this is the basic structural quality here. You've got the outer portion of your lip facing up. This upper lip's down, up, down. Just get that quality in there. Then worry about the three portions. So how do you put that in there? Well, it's the trim dynamic, really. And smooth. So now I've got a better plane. Let's come into this lower lip. Let's get that as well. Clean that marionette line up. And we're already starting to get a really nice mouth muscle. So we have the down plane of the upper lip. We have the up plane. They're not correctly sized, but they're in there. We also have the core ingredients of the upper lip is this kind of dominant shield. And then we have the lower lip as it is pulling in underneath that. The nodule at the side of the mouth then becomes this kind of downward structure that we get a little bit of a lift from. So that is the front plane of the marionette line, side plane of the mouth, the side plane of the nodule. Now I'm going to use clay or clay buildup, your choice. And I'm going to just build up the ridge. As I build up the ridge, I don't just build up the ridge, I build up all around it. But I'm just trying to add to the thickness here. And we're going to check this thickness actually, and I'm going to share with you the measurement that forensic facial reconstruction artists use. But first we're just going to make sure it's fitting in line with the basic tissue measurements that we have. There's also one thing I want to make really clear here, and that's how the nodule, it's not just this simple circle, the simple spherical quality to it. It's a bump that is actually inserting into the upper portion of your Obicularis Oris. So it has this natural tendency to overlap the fibers of the outer portion of your Obicularis Oris that are actually sweeping down and in underneath it. So this is going to be dominant over those muscles. And that's just part of the nature of the nodule at the side of the mouth, how it's working and doing its magic. So just keep in mind I've exaggerated it here, but this makes it painfully obvious what it is and where it's going. I might add a little bit of thickness to the back here. Okay, and let's just separate the lips a little bit more. If you go back to the teeth, just make sure to use the move brush to pull it back forward. So I'm pressing Alt. Really helping that up plane of the lower lip, just making sure it's nice and established. Now I might come in and start to create those three shapes that you see in Edward Lentari's book. We'll create the center portion and then the two outside portions. There's a lot of variety here, but what you need to keep in mind is just the volume, that we're going to have a bit of a recess in this area, I guess you should say. And then the volume swells on the outside as it is swelling in here in the center. Careful of making this too masculine, but that's something that's it's quite natural to do. So chances are, since we are working on a female, you're just going to have to put the head on there, have a moment of shock as the head doesn't really match, and then come in and adjust it with the move brush. But let's give her some nice, large, powerful lips. I'm going to really emphasize, in this case, a nice bow. A very feminine bow there. And the lower lip. The two planes, or two round forms here with the divide down the middle. Standard brush to put the divide in there. Smooth it out. And really have that lip, the lower lip, really insert underneath. So I'm going to just really dig that in by pressing Alt and get a nice line there. A lot of this is skin. I am grouping the skin and the muscle. Fairly safe to do that right now. But just so you know, the muscle is not going to be that large because there is skin, and there's some serious skin thickness to that to cover it up. Okay, so let's say we're within range on the lips. We've got the general elements in place. We can clean some of this up with trim dynamic and just make it even more apparent what the elements at stake are. Okay, nice and clean. Quite large, or I feel like they're quite large. That might change as we start to add all of this thickness. Again, I'm not going to sweat it because if it's too large, it's a very simple job with the move brush to adjust it. But let's talk about lip thickness for a second. Let's talk about this one equation that I find really interesting from forensic reconstruction.